In this video, we're going to talk about antidepressants, drugs that treat major depression and also disorders that have depression as a component. And I want to just start with some general characteristics before we get into the mechanism of action and before we discuss all the different antidepressants. There are many. First of all antidepressants are equally effective. So you could choose whichever you think is best for your patient, and it's going to be based on adverse effects and indications. You're going to learn there are many adverse effects, and you need to pick the one that fits best with past medical history, let's say, of your patient. Indications, we're also going to learn that many antidepressants, and that gets me to the second point, have other indications, additional indications. And there are many, such as anxiety disorders, neuropathic pain, smoking cessation. So that's also going to play a big role when you choose the antidepressant for your patient. And then I also want to mention that all antidepressants now have a black box warning. They may increase the risk of suicide in adolescents. There were some studies. And the other thing that I wanted to mention, that generally it requires weeks for improvement of symptoms. So how do the antidepressants work? Depression may be caused by decreased serotonergic and noradrenergic neurotransmission. So how could we help? Well, we could use drugs that increase the synaptic availability of different neurotransmitters, monoamine neurotransmitters, such as norepinephrine, serotonin, and dopamine. So if you're thinking about a neuron, and this could be, for example, a neuron that releases serotonin. So how could we help that we have more serotonin available? Well, these neurons have reuptake transporters. For serotonin, it's called SERT. And that's how they take back serotonin. So now we could use drugs that block this SERT. And we have drugs, and these are our famous SSRIs, which stands for selective serotonin reuptake inhibitor. So a drug that inhibits this SERT, that inhibit this reuptake, and then we're going to increase our availability of serotonin. And that's a mechanism of action of a famous antidepressant. And most of the antidepressants actually work very similarly. Either they block the SERT, the transporter that takes back serotonin. Then there's a transporter that takes back norepinephrine, and this transporter is called NET. So we have drugs that block those and, for example, the SERT. And then there's also a transporter for dopamine. This is the DAT, dopamine transporter, can be also blocked. So in the end, just to increase the availability of different monoamines. Another mechanism of action generally is, well, these different monoamines are broken down by something called MAO, monoamine oxidase. So serotonin, norepinephrine, and also dopamine is broken down by this enzyme to inactive metabolites. So if you want to increase the concentration of different monoamines, we can just block this enzyme with, for example, monoamine oxidase inhibitors, and therefore increase our levels of monoamines. And that's really what they all have in common. Either they block the reuptake or some sort of breakdown.